Welcome to this educational video about congenital optic nerve hypoplasia, or ONH. Join us as we explore this rare condition affecting the optic nerve, the vital pathway that transmits visual information from the eye to the brain. We'll cover everything from the causes and symptoms to diagnosis, treatment, and what the future holds for those affected by this condition. The exact cause of congenital optic nerve hypoplasia remains a mystery in many cases. However, several factors are believed to play a role. These include genetic mutations, problems during fetal development, maternal illness or drug use during pregnancy, and certain hormonal imbalances. In some instances, ONH can be associated with other conditions like septo-optic dysplasia, a syndrome involving optic nerve hypoplasia and pituitary gland abnormalities. Understanding these potential factors is crucial for research and preventative measures. Optic nerve hypoplasia is fundamentally characterized by an underdeveloped optic nerve. Normally, the optic nerve consists of a certain number of nerve fibers that carry visual signals. In ONH, there are significantly fewer fibers than normal. This reduction in nerve fibers directly impacts the transmission of visual information, leading to varying degrees of vision impairment. The severity of the impairment depends on the extent of optic nerve underdevelopment. The brain may also be affected, particularly in cases associated with septo-optic dysplasia, further contributing to the overall impact. Congenital optic nerve hypoplasia is a relatively rare condition, estimated to affect around 1 in 10,000 births. However, the true prevalence might be due to variations in diagnostic criteria and the possibility of milder, undiagnosed cases. There are no known geographical or racial predispositions to ONH. The condition can occur in isolation or in association with other developmental abnormalities. The signs and symptoms of ONH can vary widely depending on the severity of the nerve underdevelopment. Some individuals may experience mild vision impairment, while others may have significant vision loss or even blindness. Common symptoms include reduced visual acuity, meaning difficulty seeing things clearly, nystagmus, which are involuntary rhythmic eye movements, strabismus, or crossed eyes, and sensitivity to light. In cases where ONH is part of a syndrome like septo-optic dysplasia, additional symptoms related to hormonal imbalances or developmental delays may also be present. Diagnosing congenital optic nerve hypoplasia typically involves a comprehensive eye examination by an ophthalmologist. This includes assessing visual acuity, checking eye movements, and examining the optic nerve itself. A key diagnostic feature is the appearance of a small optic disc compared to the size of the retina, often described as a double ring sign. Further diagnostic tests may include visual field testing to assess peripheral vision and optical coherence tomography, or OCT, which provides detailed images of the optic nerve structure. MRI scans of the brain might also be recommended to rule out associated conditions like septo-optic dysplasia. While there aren't strict classifications of ONH, it's generally categorized based on the severity of optic nerve underdevelopment and the extent of vision impairment. Some cases are mild, with only subtle visual deficits, while others are more severe, leading to significant vision loss. The presence or absence of associated conditions such as septo-optic dysplasia also influences how ONH is categorized and managed. Currently, there is no cure for congenital optic nerve hypoplasia. Treatment focuses on managing the symptoms and maximizing the individual's visual potential. This may involve corrective lenses to improve visual acuity, vision therapy to enhance visual skills and eye coordination, and assistive devices such as magnifiers or screen readers. Early intervention programs are crucial to support the child's development and learning. In cases associated with hormonal imbalances, hormone replacement therapy may be necessary. Regular follow-up appointments with an ophthalmologist are essential to monitor the condition and adjust treatment as needed. Unfortunately, there is currently no known way to definitively prevent congenital optic nerve hypoplasia. However, promoting healthy pregnancies is crucial. This includes avoiding alcohol and illicit drugs during pregnancy, ensuring adequate prenatal care, and managing maternal health conditions such as diabetes. Genetic counseling may be beneficial for families with a history of ONH or associated conditions to understand the risks of recurrence. The prognosis for individuals with congenital optic nerve hypoplasia varies considerably depending on the severity of the condition. Some individuals with mild ONH may have relatively good vision and lead independent lives with minimal limitations. Others with more severe ONH may experience significant vision loss and require ongoing support. Recent research is focused on understanding the genetic factors involved in ONH, developing new diagnostic techniques, and exploring potential therapies to promote optic nerve regeneration or protect existing nerve fibers. While there are no proven treatments to reverse ONH, ongoing research offers hope for improved outcomes in the future.